Hello students, we will talk about sulfonamides. Now sulfonamides are the derivatives of sulfanilamide, that is a para-aminobenzene sulfonamide. The discovery was way back in 1935 where there was a dye which was shown to have some antibacterial property, that was prontosil. This was 4,4-sulfonyl benzyl azo M-phenyl phenylene diamine, and then later it was found that the antibacterial property resided in para-amino benzene sulfonate portion of the molecule, and then the action was explained by the fact that the in vivo azo linkage of the prontosil is reduced by azo reductase, giving sulfanilamide, and then number of compounds were synthesized. As you can see, this was a dye and it gave the two products, and the first product of the breakdown is para-amino benzene sulfonamide. Now you can see the general structure of sulfonamides. We have the NHR, so 1 sulfanilamide nitrogen, and on the fourth position you have amino, so these are designated as N1 and N4 respectively. Now we will see the different compounds. So first you can say you have sulfadiazine. So the R group structure, that means nitrogen 1, so that R is depending on this R group you have different compounds. The first one is sulfadiazine, you can see the structure of R. Then sulfaguanidine, the R is C double bond NH NH2. In sulfamethoxazole you have isoxazole ring, and we will discuss each compound. Water solubility at 25 degree is given here. And then we have sulfathiazole, sulfadimethoxine, sulfamethoxypyridazine. Now these sulfonamides in general, they are the white crystalline powder, usually sparingly soluble in water, and being weak acid they form salt with the bases. Let us talk about sulfadiazine. Now we can see the structure. The chemical name of sulfadiazine is 4-amino N2 pyrimidine or benzene sulfonamide. Okay, so here the first structure, that was sulfadiazine. So you have R group is, you can see the R group is pyrimidine. Okay, so if you have benzene 4-amino N2 pyrimidine benzene sulfonamide, or pyrimidinyl, you can say sulfanilamide. Sulfadiazine is a white yellow powder odorless stable in air but slowly darkens on exposure to air. And the use sulfadiazine is a sulfonamide of choice for CNS infections susceptible to sulfonamides, nocardiasis, antibiotic resistant, meningococcal infection, and urinary tract infections. The dose oral adult initially 2 to 4 grams for maintenance, and 500 milligram 1 every 5 hours. And then for prophylaxis of rheumatic fever, tablet 500 milligram is the dosage form. Sulfamethoxazole, this is an important compound. Now I'll just show it again. Sulfamethoxazole, we have the substitution is isoxazole. You can see here it is isoxazole, and you have 1-methyl substitution here, water solubility being sparingly soluble. The proprietary name is Jantienol. Sulfamethoxazole is very important compound for many of the infections. This is benzene sulfonamide 4-amino N 5-methyl, so that numbering starts from oxygen 1, nitrogen 2, then you have that 5-membered isoxazole ring, and on that you have 5-methyl. So 5-methyl 3-isoxazolyl 4-amino benzene sulfonamide. or you can write N1 5-methyl-3-isoxazolyl sulfanilamide. Now, white to off-white crystalline powder, practically odorless, stable in air and very slightly soluble in water. This is used principally in lower urinary tract and certain systemic infections caused by susceptible microorganisms such as E. coli and P. mirabilis. It's also been used successfully in gonorrhea, meningitis, and serious respiratory tract infection. The dosage, it is oral, adult, 2 mg followed by 1 gram 2 to 3 times a day. Infant 50 to 60 mg per kg of the body weight. Now we have sulfathiazole. So we'll just check again what is sulfathiazole. Sulfathiazole, you have thiazole ring. Okay, so you have 5-membered ring having nitrogen and sulfur, that is thiazole. So sulfathiazole is N-thiazolyl sulfanilamide, white or faintly yellow crystals, granules and powders. No, not in use due to hypersensitivity in combination with sulfbenzamide and sulfacetamide for the topical treatment of vaginitis caused by Gardnerella vaginalis. Then we will see succinyl sulfathiazole. This is a succinylic acid monohydrate derivative of sulfathiazole. This is white odorless crystalline powder with a bitter taste, melting point 19, darkens on exposure to air. This is used mainly to reduce the bacterial content of large intestine and as an adjunct in the treatment of ulcerative colitis. That is succinyl sulfathiazole. So you can see the substitution is on NH4 here. And then we have dosage form as tablets. We have the next important compound, sulfacetamide sodium. As you can see the nomenclature, this is sulfacetamide N4 aminophenyl sulfonyl monosodium salt monohydrate. Now this is a white crystalline odorless powder with a bitter taste, and this benefit is in ophthalmologic infection. So you can remember sulfacetamide is in ophthalmologic infection, especially caused by pyrogenic cocci, gonococcus and E. coli. Trachoma may also sometimes respond well. This is also used in the topical treatment of acne vulgaris and seborrheic dermatitis. So the dosage form: lotion, ophthalmic ointment 10%, ophthalmic solution 10, 15 and 30%. And then is the most important compound, that is cotrimoxazole. You have the brand name is Eptron, Bactrim, etc. Now the trimethoprim and sulfamethoxazole combination is called as cotrimoxazole. Now this is taken in the percentage of 5:1. Now this combination has replaced most of the sulfonamide in therapy because the combination gives the protection against gram positive as well as gram negative, and it has a truly synergistic action. Now what is the mechanism? It inhibits the 2 steps in the bacterial metabolism. And now we can see here in the diagram, sulfonamides, they will inhibit dihydropteroate synthase enzyme. Now this converts this dihydropteroic acid and glutamic acid, and it converts into dihydrofolic acid, and then that is converted into folic acid, which is required for the bacteria. So this first step that enzyme is inhibited by sulfonamides, and trimethoprim inhibits the conversion of tetrahydrofolic acid to folic acid. Now the enzyme here, it is dihydrofolate reductase. So trimethoprim will inhibit reductase enzyme, sulfonamides will inhibit dihydropteroate synthase. So this is how the biosynthetic steps are interfered with. And then now this cotrimoxazole is used to treatment of uncomplicated lower respiratory tract, lower urinary tract, acute and chronic. Is highly effective. Then this is a combination, this is a drug of choice for infection called by Shigella and pneumocystis carinii. The later is the cause of infection death in the AIDS patient. So this combination is first given to AIDS patients suffering from pneumonia. It's also effective for typhoid and paratyphoid fever, bacterial infection of the lower respiratory tract, and also uncomplicated gonorrhea, vivax, and falciparum malaria. Then we have the dosage. The usual adult dose is 800 milligram of sulfamethoxazole and 160 milligram of trimethoprim every 12 hours for 10 to 14 days. For children, 8 milligram per kg trimethoprim, 40 milligram per kg of sulfamethoxazole in 2 divided dosage every 12 hours for 10 days. And in women, 80 to 40 after intercourse 3 times weekly for 6 to 12 months. The dosage: single strength trimethoprim 80 plus sulfamethoxazole 400. That means 1 of trimethoprim and 5 of, so that is how it is 1:5 combination. And then you have oral suspension, 200 milligram of sulfamethoxazole. Pediatric suspension 40 plus 200 milligrams.